to talk about Botox for forehead shaping. All right, and the reason why I think this is very important is because this is the one area of Botox that if you don't do it exactly right, it's most noticeable. So the person will have a little bit of a defect. Okay, so one eyebrow will be higher than the other, or you'll get the drooping, or drooping on both eyes. So this, I think, is the most important area. You know, I'm not promoting making a mistake over on the side, but you know, it's not quite as noticeable on the side compared to the forehead. All right, so let's go over a couple things that are important with the forehead. Number one, you may have heard of this area. It's called the no injection zone. All right, the no injection zone in the forehead is 1 finger breadth above the eyebrow. All right, so don't inject the frontalis muscle 1 finger breadth above the eyebrow. And notice how I said don't inject the frontalis muscle, because the corrugator muscle does go up above the eyebrow. All right, so if you apply it to that muscle as well, you're not going to be injecting the corrugator muscle. So it's 1 finger breadth above the eyebrow. All right, don't inject the frontalis muscle. And the reason for that is very, very simple. When you're injecting the frontalis muscle, just kind of picture what happens. So let's say you're injecting up along here and here, and you inject the frontalis muscle, it naturally, because that muscle is an elevator, right? It's an elevator. So naturally, you've relaxed that muscle, it's going to tend to bring the whole forehead down. And if you put your fingers up here and you push down, you don't really notice too much. But and this is very common, it happens very, very frequently. I see patients every day that have gone to another doctor or another nurse or whoever, and they injected too low. So they injected the frontalis right above the eyebrows, all right, and they look like this. Okay, it's so easy to do. It's easy a little bit easy to correct too. But just be careful. Don't inject the frontalis too low. But what happens if the patient has lines over there? What are you going to do then? You can't inject it. You have to tell your patient, listen, I don't want to go too low, because if I go too low, it's not going to do you justice at all. It's going to bring your eyebrows down. So we can't inject too low. All right. So this is a good picture, because this whole area here. It may look bigger than a finger breadth, but it's a little bit less than that. This whole area you don't want to inject. You want to start up higher than that. All right. So that was the first point that I wanted to make, is that no injection zone. Don't inject 1 finger breadth above the eyebrow. Okay, but what we were talking about earlier, and I'll just kind of repeat it now for the sake of you guys, is on that first visit, even if you think, you know, you could inject up to 30 units, anybody could go in there and do the maximum amount. That's easy, all right? There's not any skill for that, and you're going to get a result where the person is frozen. The trick is to tell the person that you're going to use the lowest dosage that's going to give them a good result, and if they need to, they could come back 7 to 10 days later, and you could do a little touch-up. And again, that's going to save them a lot of money, because you're not going to inject them more than they needed. So let's say on this person, you're going to inject 8 to 12 units, which is a little bit, but it's sufficient to get a decent result. All right, so first visit, forehead, 8 to 12 units. Have them come back 7 to 10 days later, then you could do a little touch-up. All right, and what you would do typically is you want to start laterally, and you just want to go all the way across the forehead. All right, a common mistake, and I could tell you this, and it's happened to myself. A plastic surgeon injected me, and he saw that I had lines mostly like in the middle, and you'll see this a lot, where people will have lines just right across the middle, like this. And if you just inject that area, and you don't go laterally, and you just inject over here, think about what happens. Is you're injecting the frontalis here, so that area comes down, but you didn't inject laterally over here. All right, so that area goes up like that. And you've created a pretty strong lateral eyebrow lift. And you remember I told you earlier there's another way to get that lateral eyebrow lift. One way is to inject the lateral orbicularis oculi muscle. The other way is to inject the forehead, the frontalis here, and not over here. Okay? And naturally, it's going to create this. Okay? But also, you're not injecting the lines over here. So it's kind of like a give and take thing. They may not have too many lines on this area, so you can get away with doing that. Okay, but getting back to the forehead shaping, all right, what you want to do is you want to start laterally and go all the way across, okay, multiple lines. I have a couple other slides on this as well. Male versus female, all right, there is a difference, because male patients generally do not want that Spock look. They don't want that lateral eyebrow lift, okay? So make sure you start laterally. In this slide, you could line it up to the corner of the eyebrow, all right, and you want to start laterally and go, especially if you see a peak. Like if you see somebody that has a peaked eyebrow, you want to inject the frontalis above that area high enough to level it out. So start here and go all the way across. Okay, so that's male versus female. Male, definitely, you know, starting laterally and going across. A female, depending upon if they want that lateral eyebrow lift or not, you may go more towards the middle and not inject the lateral part. Okay, so we talked about the dosage for training purposes and for the first set of patients, 8 to 12 units. Then after you get comfortable, after you have your documentation and you see what that does, you know, after you get good, then you can start increasing the dosage. And only through experience will you really know how much the person needs. This is, some people call this the staggered technique. All right, and what you're doing is you're injecting across the forehead like this, all right, and then the next row, you're injecting in between the lines from before. So if you had 4 spots right here, the next row you're going in between that. All right, and if you could see from this picture, this is very typical. This is just how you would inject here. All right, just make sure you go far enough laterally that you're not going to create that eyebrow lift unless that's what you intended to do. Here's a good before and after. You can see that. All right, the other trick, I think what's important is with forehead shaving is you really don't want to over-inject. You don't want to freeze their forehead. You want to be able to have the patient retain their animation so that they can relax and show expression. That's pretty important.